Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
A mission to
Delivery of. Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. And today I have with me Dr. Chad Rodgers. He is the Chief Medical Officer here at AFMC. Thanks so much for being here, Dr. Chad.
Glad to be here.
So we're talking about back to school wellness, preparedness. What are the most important health checkups and screenings for children that they should have before returning to school?
Right. There's a lot of things to make sure kids are healthy so that they're ready to learn when they go back to school. So, kind of your typical child visits, a lot of times you'll hear people call them sports physicals or just health supervision exams. They're all sort of similar, although the sports tends to be kind of a little bit more focused towards athletics, but they all sort of involve, getting into the office, getting to the doctor, doing some screens to make sure that your mental health is doing well, that you're growing well, that you have the nutrition and the sleep and all the things that you need to kind of have lined out to go back to school. So it's a really important visit. It can happen really any time of the year, but a lot of people, because of the return to school, need paperwork, and so that becomes sort of the back to school rush.
And how can healthcare providers better support families in preparing their children for a healthy school year?
Yeah, so I think any time of the year is a good time to kind of talk about school and what the school environment, making sure that kids have what they need when they're at school as far as medications and stuff like that. I think kind of encouraging people to kind of make that yearly visit so that they're already kind of plugged in. Even when you have a healthy child, there's a lot of times where they haven't got the doctor, in several months or sometimes years, depending how they're doing. But yet you're not checking their growth every day. And maybe you don't know that it's time to check blood work, or there may be certain vaccinations that they need. And so it's, sort of that kind of yearly visit, kind of making that part of the routine, even if you have a healthy kid, that sometimes we can identify things. I think one of the things too that we often see is sometimes kids are dealing with some anxiety and depression that they're really just not talking about, or maybe it's just kind of low grade, but it kind of brings it to the forefront. So it's a really good opportunity to kind of get to talk about those things.
And you mentioned vaccinations. What are the recommended vaccinations for school-age children, and why is timely immunization so critical?
Yeah, so I always say the big things are 4, 11, and 16. Those are the ages to sort of remember for your school-age kids. So there's rounds of shots at the 4-year-old visit, at the 11-year-old visit, and at the 16-year-old visit. And there's a lot of 16-year-olds, like I was saying, that haven't been to the doctor in 2 or 3 years. And so sometimes that's a really good kind of point to kind of make sure we're all caught up. But those are when some routine immunizations are given, and you can't have them unless you can't go back to school unless you have them. And so school nurses are usually pretty good about looking at people's immunization records and making sure that they're up to date. And if you show up and you haven't had those, they may not let you come back to school, or they may give you a timeline to get back to school. The tough part is if you're 3 years old and 11 months and 30 days and you come in one day early for those shots. Not that those shots won't work, but they're not going to count. And so they need to be at least 4 and had their 11th birthday and had their 16th birthday in order to get those shots, in order for them to kind of quote unquote count. And the school nurse can look that up. The clinic that you go to can look that up. It's all within the state registry. So the health department also has those. So those are also good places. If you have an older child and you're on the run and you're just needing to get some shots, sometimes for like your 16-year-olds especially, and if they're just needing some boosters, the pharmacy may be a good place to get some shots as well.
And we can address, or how can we address, vaccine hesitancy in our communities, and particularly around flu and COVID vaccines?
Yeah, it's been a particularly, more difficult to kind of, especially when it comes to flu and COVID. I think people kind of feel like COVID has sort of faded a little bit, although we're still seeing cases of COVID. People are still getting sick from COVID. People are still dying from COVID. But it wasn't as bad as it was during the pandemic. Flu has always been just traditionally a very hard, vaccine to address. But a lot of people have had the experience that they got the flu shot and they felt kind of achy after, or maybe missed a day of work because they didn't feel good. But that's actually your immune system responding to the shot. Or sometimes you just happen to be unlucky and have gotten something else in the meantime. But that flu shot, you may still get the flu, but you've got some protections there. You've got some immunity to keep you from getting really sick. But people don't always see that real directly. But people do get really sick every year, healthy people, and can die from like pneumonias and stuff associated with the flu. So the vaccines are still very, real important. The routine vaccinations, where there is some hesitancy, you don't see quite as much than you do around the flu and the COVID. But, we know that making sure that all kids are sort of vaccinated is the best way to protect people, and especially people who aren't vaccinated, or maybe people who don't have a good immune system because they're getting chemotherapy or something like that. So really kind of talking to parents about what their concerns are, letting them know what shots they're getting, why they're important. I think having really open conversations. Parents sometimes are just, you have children, so you kind of can relate. Like, you've been charged with this life and you want to make sure that they grow up healthy, and you don't want to do anything to harm them. And then you hear blips of information out there that may be good information, may be a bad information, but you don't really know. And then you need to kind of sort that all out. So it's not unusual to have questions. It's not unusual to have fears. But I think in the end, we sort of know the science. We know the data. We know that people do well with shots and how important they are to prevent disease. So I think those kind of healthy, respectful conversations, and kind of trying to be having a good relationship with your primary care provider, your pediatrician, your nurse practitioner, your family doctor, that you can talk about those things. And sometimes people we're like, I've heard this. Is this, what can you tell me about this? And I think that's a great opportunity. Number one, it's also a great opportunity to learn more about vaccines. So.
And you touched on this a little bit about mental health and behavioral health. Some signs that a child may be struggling with anxiety or depression as the school year begins. What should a parent or even a pediatrician look for?
Right. So, anytime there's big changes in life, sometimes you're going to see a little flurry of anxiety and depression. It's not unhealthy or uncommon to worry, and it's not uncommon or unhealthy to be sad. But and so definitely when you have some unknowns, starting a new school, maybe changing towns altogether and going to a whole new place, can be kind of worrisome for kids. So then it's kind of a question of how it's impacting their life. So if they're not wanting to go to school, they're not sleeping well, they're not eating well, they don't want to go sports, they don't want to go hang out with their friends, then it may be a little bit more unusual. The other thing is sometimes teenagers just withdraw. They just like to be in their room and be left alone, and that's not an unhealthy or unusual teenage behavior. And they may not be telling their parents everything they need to know. So that's where, when they come in for those checkups, those screening tools that we use can kind of pull that out, and to have a little discussion to normalize the concept that worrying a little bit or being sad is normal, but when it becomes unhealthy. So it's just a really, those things sometimes kind of come and go as well. So I think if kids are doing a better job, schools are doing a better job of talking about mental health, and so kids know the language a little bit better as well. So, it's hard if you're feeling something, it's hard to know how to describe it if you don't have the word. So another good opportunity to kind of talk about those things.
And you mentioned schools. Schools and pediatricians can often work in tandem to support students' needs and mental health early on in the school year.
Yeah. Well, kids are definitely with their parents a lot, but most of their waking hours are really, especially during the school year, at the school. So they're really sometimes pretty aware with what's going on with the kids. Sometimes, parents have a lot going on with work, or they're coordinating childcare and they're handing kids off from grandparents to other parents to aftercare services. They may not realize sometimes that their kid has been coughing all day, or maybe they woke up and they were fine, but they developed fever in the day. So school is a real important place for, and school nurses are so important, and especially a good school nurse is going to really kind of watch for those kids that are coming in, asking for their albuterol a lot. Maybe they're coming to the nurse with the headaches a lot, that they're not telling their parents after they get home from school because, they're better. But that communication between the school nurse and the parents, and sometimes with the physician, there are some laws, with the exchange of information and protection, just like there are on the healthcare end, that you don't just share information. But there are forms and there are ways to communicate to make sure that kids have what they need while they're at school, and then also to get that information back to the doctor.
And what role does nutrition play in classroom performance? It's a big thing.
It's a huge thing. I mean, I think people are becoming more and more aware the fact that if kids are hungry, they're not going to be able to learn, and that you can't meet them and you can't even begin to teach. I mean, we've all experienced being hangry, and it's hard to think, it's hard to make a decision. It's hard to just be in a place where you're ready to learn if you're hungry. So if we're not meeting those basic needs of our kids, then they're not going to be ready. But school is such a good place. Again, it's where they spend a lot of their waking hours. They're there for breakfast and for lunch. We know that some of the kids, that's the only 2 meals they get in a day, because a lot of families, especially in Arkansas, are dealing with food insecurity. And, I think the state has done a lot of work to try to expand those, not just during the school year, but also during the summer. And so there's been a lot of efforts just to make sure that kids have what they need to learn and grow.
And let's talk about sleep schedules. So we hear where we try to get our kids back on a sleep schedule like a month before they go back to school. Is that necessary? Is it important?
Yeah, it's real important, because you can't go from staying up until 2 and 4 in the morning to going to bed at 10 and then waking up at 6 in the morning. It's amazing to me how many kids I see, after lunch in the clinic, and the teenagers particularly, and you can tell that they just got out of bed, and that's what summer is for. And summer is also a good time to be restorative and to catch up on sleep and to have some fun. But teens tend to stay up later. They just kind of naturally do that. But those couple of weeks before school, we really kind of start to get back on our routine, trying to go to bed closer to 9 or 10 for particularly young children, even earlier, to make sure that they're getting adequate sleep so that they're able to get up. Sometimes the biggest thing that you see is, kids will have trouble falling asleep or staying asleep. Those are things to talk to your doctor about. If you're having some daytime sleepiness as well, and like they're falling asleep in class, and those are sort of red flags that the kids are not getting enough rest. And routine is really important for all of us. It's not just the kids, it's all of us.
That was actually my next question. What are some tips that families can do to get into a routine, establish that routine before school? Yeah,
I think one thing that they can do is, if they're staying up till 2 and getting up at noon, then we may need to step it back. You can't say, okay, this Saturday night we're all going to bed at 9 o'clock, because you're going to lay in bed staring at the ceiling for a few hours. So trying to step it back by 15 minutes, 30 minutes each night before going back to school. So thinking kind of ahead and trying to get back onto schedules, trying to get up a little bit earlier the couple of days beforehand. I think getting up and do some physical activity so that they just don't go right back to bed, but trying to get those routines back. It kind of helps us all. We all know that I say moms do more before 7 a.m. than I'll do all day long, just to get the kids out the door. If you have the kids, with enough rest, and then they have their breakfast and then you get them and out the door, it's going to make a big difference in that back to school rush and the chaos that comes along, and the stress.
It is stressful, and hygiene practices also fall into that.
Yeah.
But they also prevent illness.
Correct.
Especially in classrooms and shared spaces. What are some of the things that the healthcare providers should be telling their patients?
Yeah. And I know that a lot of times it's battles, especially with older children, and making them aware. And, kids, if you're around yourself all day long, you don't smell yourself, but other people get to smell you. And so it is actually part of sort of the routine. I think I kind of take the perspective that you talked about, that it's part of being healthy. Your skin has to be healthy. If your skin is not healthy, it's going to break down. You're going to get sores. You're going to get infections, things like that. It's also, your skin is sort of a protective barrier from the outside world. So, kind of talking, especially to as kids are getting more independent, about the importance of taking a bath. It can also become a part. Speaking of routines, it can become a great part of their day in the evening in order to calm down and relax. Taking a warm shower, getting their shower done so they don't have to get up early. Some kids are going to do better to get up early, a little bit earlier in the morning, take their shower then to wake themselves up. So again, trying to schedule out what's going to be best for your kid, whether that's in the evening or the morning, it's going to be part of that routine.
How can healthcare systems ensure equitable access to back-to-school care for underserved populations? I mean, that's a hot topic.
Yeah. So, number one, people, in order to have healthcare, have to have access, and they have to have insurance or some way to pay for the healthcare. So I think, working to make sure that everybody has healthcare for their kids, whether that's through your work or whether that's through Medicaid or through our kids, to make sure that all those services should be covered. Those preventive services and shots are covered by insurance. So there's usually not much barrier. In fact, for most plans, in fact, I think for all plans, there's not a copay to go for a checkup or a wellness visit. It does take a little bit more time. So that's kind of removes the barrier of that $5 or $10 or $20 or $30 that you may have to pay when they're sick or for some other visit. But wellness visits are covered, shots are covered, screenings for the most part are covered. Not all, but most are. So making sure that we all kind of have equal access to those tools to make sure that we're healthy. Because when you're healthy, then I'm healthy. It's kind of a community thing. It's not, health doesn't tend to be just a real individualistic thing. And in order for the whole family to be healthy, it's important for all members of the family to be healthy. So.
And one key message that you want parents, educators, healthcare professionals to know, to keep in mind for this back to school as we dive into the fall semester.
It gets very busy, and it does create a lot of panic because then you're like, oh, well, they're not going to be able to, they often get told they can't go back to school until they've had the checkup. So I think, thinking early, sometimes we're kind of later into the summer now, but early in the summer as people go on vacation, that's a good time to get in for the visits. It's not quite as busy. Maybe even making your annual visit around your birthday. A lot of providers will do your school physical during your checkup, during your annual physical around your birthday. And that way you're not waiting unless you're an August the 15th birthday or something like that, you probably wouldn't think about other times of the year. But that way you're sort of done. And sometimes there's just some paperwork or some shots record that needs to be updated. And that can be done with the nursing, not a whole visit. So kind of making that part of your annual routine of going to the doctor, and making the other thing is a good time when you're off, in the summer, if you're kind of doing a little staycation, to go ahead and get your dental visits and get your your checkups and those sort of things, so that the kids have the checkups that they need to get back to school.
Well, Dr. Rodgers, thanks so much for talking about important information and getting everybody ready back to school. I'm not ready for summer to end.
I'm not either. I want to sleep late.
Me too, and maybe a little vacation.
Yeah,
would be
vacation.
Nice. Well, thank you so much for being here.
Yeah, glad to be here.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.